This is LiveWell Talk on COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. In this week, the update, I'm going to cover vaccine. There's been a new news as of this morning, as well as some findings from a study in Japan and an update on what we're seeing in the hospital. The first thing that discussed, you've probably seen a little bit of this in the news media, but the contrast that we use for x-ray studies, there's been a supply shortage, and we've done a good job of conserving that and making things work, but we are hopeful that, optimistically hopeful, cautiously, that soon that supply shortage will be addressed, and it's no other different supply shortage that everybody else feels at their jobs of recent. In the hospital, we have single-digit COVID patients, and it remains that well of under 10. Vaccinated versus unvaccinated is 50-50. They're the same. So there's no real disproportionate unvaccinated versus vaccinated, but it's less than 10 people, so it's not a big sampling size. New in the COVID-19 vaccine front is Moderna has the initial approval to go down to 6 years of age, up to 17 years of age with their vaccines, and then subsequently the boosters will get added. And that matches, or closely matches, Pfizer, which goes down to the age of 5. Community level in Link County is uniquely, and you can see this on the CDC website, we are the highest county in Iowa, and that is kind of a bummer. But that keeps us with the universal masking in the hospital or healthcare facilities. Community level itself is low. Transmission level is high. The level itself is low. And that is for the county and for the state, actually. If you remember from before, the transmission level means that you have, it factors in just cases per 100,000. The community level factors in hospital resources. And so I actually feel the community level is more accurate of what's going on in the community, and our level will be low. So we'll follow those community transmission levels weekly. We check them. And when we're down at below moderate, which is below 50 cases per 100,000, for 2 weeks straight, we can get rid of the mask. And so we're all looking forward to that. Now back to this recent study from Japan. So we know, or we were told, that obesity is a risk factor for COVID-19. In the country of Japan, they have about an obesity rate of 4%. The United States is 40%, so a tenfold increase. But they also went back and looked at their COVID deaths, and they had 240 per 1 million residents. So 240 per 1 million residents, and that 240 were significantly, the obesity was significant. The United States, we had right at 33,500, somewhere in there, out of a million, so a tenfold increase. So there's a proportional representation of the percentage of obesity in the population and the percentage of, and the number of deaths per 1 million residents. So it really does factor in that obesity is a risk factor, and that should probably be included in recommendations from your physician for the booster. We shut down the gyms, we closed the parks, which we should have kept them open in retrospect. But being obese factors into delayed, decreased immune system. That's what they think the pathophysiology is. Well, we'll keep you informed on transmission level in the community, and we'll be on here right away as when we learn that it's in moderate for 2 weeks, and happily report that we can wear masks only in direct patient care. Until that time, thank you for listening. And for the latest on COVID-19, vaccine information, and more, visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.